Good afternoon, everyone, and thank you so much for joining the Alzheimer's Foundation of America for our Care Connection webinar this month. We're really excited to have a team today coming and talk to us about elder abuse. Just a few reminders before we go ahead and get started. This webinar will be recorded and will live on AFA's website. If any of your colleagues have missed today's webinar or would want to re-listen, you can find it there. Also on the right-hand side portal, you'll see handouts from today's presentation, including the slide deck. So if you're interested in getting a copy of the slide deck, you will see that here on the right-hand side portal where you see handouts. You'll also see a few other informational flyers from us here at the organization. These can be downloaded before the presentation and during the presentation. So before we get started, again, I'm Molly Fogel. I'm the Director of Education and Social Services here at the Alzheimer's Foundation of America, and we are so excited today to be bringing some staff from the National Center of Elder Abuse and the Frameworks Institute to this presentation to talk about elder abuse. So I'm going to welcome Eden and Allie. Eden earned a Bachelor in Science in HDFS from the Pennsylvania State University and is currently an MPA candidate at the USC Sol Price School of Public Policy. She has devoted her 11-year career at assisting older people and people with disabilities and has an acute passion for socio-demographic and geographic trends, as well as the issues of aging, public housing transformation, human rights, and homelessness. Allie Newman received her Bachelor's in Arts in Sociology from the University of California in Berkeley, 2014. She has over 5 years' experience in supporting public service organizations in communications, event coordination, and internal operations. As you are all in listen-only mode, Eden and Allie will be able to provide their presentation, and at the end of the presentation, you can type in your questions to the right-hand side portal, and we'll be moderating them to Allie and Eden. So without further ado, please feel free, Allie and Eden, to go ahead and share with us your information today. Thanks so much.
We are very pleased to be participating in today's webinar and having you all join in, and we're clearly focusing on a very important topic. At the National Center on Elder Abuse, we're continuously educating, training, conducting outreach, and creating information and resources for members of the public and also professionals. Thinking about what we really wanted you to learn today, there are a list of objectives here that we have up on the screen that we're hoping to meet during this webinar. First, we're going to tell you a little bit about the National Center on Elder Abuse. Then we'll be providing you with very brief highlights on elder abuse, following up at the tail end with some resources. Next, oftentimes we're left thinking about how we could make this issue resonate with multiple audiences. The Reframing Elder Abuse Initiative is going to help you understand how to effectively frame the conversation on the topic of elder abuse and mistreatment. Then we'll give you some insight into how we've created materials, and finally provide you with some pointers on how to utilize this strategy in your conversations and in your own outreach. So at the NCEA, we recognize that it's up to all of us as a community to ensure the right social structures existing in place so that people can remain connected to their communities and to society as a whole. And this will reduce the likelihood of abuse. The NCEA serves as a national resource center dedicated to engaging and empowering older people so that they may be an advocate for themselves and their communities. We're one of 27 federally designated resource centers, and we're here thanks to the Older Americans Act. We're a national authority on elder abuse, neglect, and exploitation, and we essentially serve as an information clearinghouse. So our goal is to really improve the national response, and the way that we're doing that at the NCEA is by gathering, housing, and disseminating current information. We're stimulating and identifying new approaches, and we're trying to also detect and address gaps in the field. So next, I'll turn it over to Allie, who's going to tell you more about the goals of the Reframing Elder Abuse Initiative, which we really will be focusing on for today's presentation.
Thank you for that phenomenal introduction, Molly and Eden. I sure hope I can live up to it. My name is Allie. I'm the project coordinator for the Reframing Elder Abuse project within the NCEA that we are all here to talk about today. So like any good project, the Reframing Elder Abuse project started off with a problem. We at the NCEA and our funder, who Eden mentioned, Administration on Community Living or Administration on Aging, we realized we had a communications problem. We had all of these communications materials to talk to the public about the issue of elder abuse, in the hope that they would take action without really knowing if those communication materials were actually engaging, if it was really getting them to want to take action on our issue. So that's when we realized we needed a little help. We needed to know if our communication materials were actually working. So we learned about an organization called the Frameworks Institute. Frameworks Institute is an organization that conducts communications research on social issues to make sure that the way that you are communicating about your social issue is actually productive with the public. So we worked with the Frameworks Institute to, number one, understand how the public conceptualizes elder abuse. And what I say when I say the public, I mean members of the national public who don't engage with the issue of elder abuse as much as Eden and I do at the NCEA. So people like students who may not even be familiar with the issue, people like police officers who may not come across cases of elder abuse as often as we think. So those are the type of people we sought to understand understand how they, thought about elder abuse with the Frameworks Institute. And then from there, we used those understandings that the Frameworks Institute found to devise a new communication strategy with the public that is more engaging, that gets them to understand the causes and solutions to our issue, so they will want to take action. And then the last phase of this Reframing Elder Abuse project is that we at the NCEA, we have to disseminate this new communication strategy out to professionals who will actually utilize it in their communications materials, and to the public who are the people who will be engaging on this issue and the people we want to engage on the issue. So that is why we're talking to you today. We are here in the hopes that you will utilize this strategy, learn from it, and we're disseminating this strategy to you all. Our long-term goal with this project is to build a society that makes informed choices on policies and practices that address elder abuse based on valid and reliable information.
A very brief overview of elder abuse would be helpful so that you could see the importance of educating people on this topic and understand really how people are thinking about it. And in turn, this will help you in reframing all of our thinking about how we're approaching this topic. So according to the U.S. Department of Justice and the Department of Health and Human Services, 1 in 10 Americans over the age of 60 has experienced elder abuse or neglect. And furthermore, research indicates that only 1 in 24 cases are ever making it to the attention of authorities who are capable of intervening. These numbers indicate to us that it's vastly underreported and is continuing to rise. So what does this mean exactly? This makes it a priority social justice issue for all of us. And communities are affected on so many levels when you think about it, including public health, public advocacy, and it overburdens social service systems that are providing essential case management to people. Let's not forget about the economy either. Most importantly, the costs of elder abuse are exceptionally high for the individuals who have experienced it and their loved ones, and really our society as a whole. So some of the losses that we're talking about are from things like people's homes, vehicles, their life savings, their dignity, independence, and possibly their lives. So for society, what this does is create healthcare and legal costs, which are shouldered by programs like Medicare and Medicaid, and it vastly reduces older people's participation in our communities. So these are the forms that we oftentimes refer to: physical, emotional, sexual, neglect, and financial. And on the next slide, we just want you to keep in mind of some of what you're about to hear. And as I had mentioned before, later on in the presentation, we're going to be walking through some befores and afters of materials that we've revised so that you could see the transformation in language. So in terms of physical abuse, this may result in bodily injury, physical pain, or impairment, and it can include such things as striking, beating, pushing, shoving, etc. Emotional abuse is unexplained or uncharacteristic changes in behavior, such as withdrawal from normal activities, unexplained changes in alertness, and verbal assaults, insults, threats, intimidation, humiliation. Sexual abuse is defined as the non-consensual sexual act of any kind with an older person, and sexual contact with any person incapable of giving consent is also considered sexual abuse. So we've had listed here for you some examples. Neglect is the refusal or failure to fulfill any part of a person's obligations or duty to older people. And this includes paying bills, providing care, and supplying basic needs. And finally, financial is something that we oftentimes, through our technical assistance delivery, hear about the most. And this is the legal or improper use of an older person's funds, their property, or assets. So anything from cashing checks, forging signatures, stealing money, signing documents. And really, it's not uncommon to hear about multiple forms of abuse occurring at the same time: emotional coupled with physical abuse, neglect and financial exploitation, or even emotional and sexual abuse. So now this is a perfect segue to break down exactly how the public is perceiving elder abuse. And this will allow you to see how effective the Reframing Elder Abuse communication strategy is, leading us to create societal solutions to overcome it. So I'll turn it back to Allie.
Thank you, Eden. So now I will go over what the Frameworks Institute found in their first phase of research. So I talked about the short-term goal of understanding how the public perceives elder abuse. So this slide that I'm showing you now is going to illustrate what the Frameworks Institute found when they interviewed members of the general public on elder abuse. They interviewed members of the general public at like the malls of America to see what they thought about elder abuse, and they organized their research in what they call a swamp of elder abuse, which is just a metaphor for saying that there is a whole mess of things that goes on in our head when we think about certain issues. So in our head, it's really just a swamp of all of these different cognitive shortcuts, is what they say. So when the Frameworks Institute mentioned elder abuse and tried to describe it to the public, this is everything that came up in their mind. I'm going to walk you through it right now. So first thing first, when we mention elder abuse, the public generally thinks, okay, elder plus abuse, right? This very two things that we're saying. So they agree that it's unacceptable, which is good. They thought it was wrong. That's good. But they also kind of thought of it as just a two-person relationship. So they didn't really think that neglect, social isolation, or self-neglect really qualified as an elder abuse. So they thought there had to be a perpetrator. And then also they didn't really understand how sexual abuse was a form of abuse for older adults, because they thought of older adults as non-sexual beings because of ageist kind of ideals in our society. It was a very hard thing for them to think about. So we, from those understandings that the Frameworks Institute found, we learned that we need to expand the definition of elder abuse to include self-neglect and sexual abuse, so that people can understand that elder abuse is more than just kind of a two-person relationship, but that neglect, self-neglect, and social isolation can be involved in elder abuse as well. We need to expand it to include sexual abuse as well. And this is going to help people understand how there's different social systems at play when it comes to elder abuse, and it is an issue that not just affects the victim of elder abuse, but also our society as a whole. So we really need to expand the definition to include the risk factors and the consequences at a societal level, like Eden mentioned, the consequences on our healthcare system as well. Secondly, they found that when it comes to thinking about elders or older adults, older people, there was a large cognitive shortcut of deterioration when it comes to older adults. So they thought of older adults as inherently vulnerable because they were dependent sometimes, and then also they had a paternalistic model of older adults. So they thought of older adults as objects of care rather than agents of change, participating members of our society. And this led to a little bit of fatalism when it came to solving our issue of elder abuse, because they thought of older adults as inherently vulnerable, so they didn't see that there was anything we could do to prevent the issue of elder abuse from happening. So instead of really focusing on deterioration, we really need to talk about the importance of connections and use images and languages that empower older people and reduce risk factors of abuse, such as social isolation, lack of training, maybe ageism that exists. So we really need to be explaining those risk factors instead of focusing on this deterioration model. Thirdly, there was the sense that modern life was to blame for the issue of elder abuse. They saw nursing homes as an unfortunate necessity, a cultural devaluation of older people that just exists in our modern life. Today, everyone's really busy. There's not enough time to devote to this issue. But this also led to a little bit of fatalism, because modern life became kind of an excuse. It's such an overwhelming thing. How can we possibly solve the issue of modern life? So it led to, again, that fatalism towards solving our issue. How can we change something so deep and seeming unchangeable, such as modern life? Fourthly, there was a spotlight on individuals. And what this means is there was this focus on the victim or the perpetrator, focus on individual cases of elder abuse. I know during elder abuse presentations that we have done in the past with the NCEA, sometimes we would use individual cases, and that's actually can be something we want to be a little wary about, because what happens when we use individual cases is sometimes the public will tend to blame the perpetrator so much they can't get past the condemnation of them to see how larger systems may be at play in preventing the situation of elder abuse. So they will see the perpetrator as just a greedy person, lazy, lacking moral character, or as a sicko, and they can't really see past that towards solutions or the larger structural systems at play. And again, it could kind of lead toward victim blaming too, when we focus so much on the victim or the person who experiences the abuse, because we notice when we use those individual cases, people would start to say things like, well, that person just didn't know or is not very financially savvy, and it led to a little bit of victim blaming. So that's another reason why we try and refrain from this spotlight on individuals time and time again now. Lastly, when it came to solutions to the issue of elder abuse, overall, people were very fatalistic about solving the issue. I know I've already stated that, but it's really something that is involved with all of these different swamp factors, as if we say, these cognitive shortcuts, is people didn't really see a lot that could be done to solve this issue. They did say awareness and education, but frankly, a lot of the awareness and education that is out there on elder abuse focuses on surveillance and prosecution. So very much after the fact solutions to specific cases of elder abuse, after the abuse has already happened, but not focusing on preventive solutions like preventing social isolation to prevent and reduce issues of elder abuse. They did, there was a little bit of a ray of sunshine, or lily pad as Frameworks Institute likes to call it, where they thought that support for caregivers was needed because they did feel that caregivers may be pushed to the limit. So that is something that we could capitalize on in our communications materials. They do really see that support for caregivers is necessary. But as you can see, overall, they're generally fatalistic about solutions. So we definitely need to make sure we're emphasizing solutions that focus on collective responsibility to solve this issue in our communications materials. So from those understandings of elder abuse that the Frameworks Institute found, they were able to come up with a new communication strategy on elder abuse that is more productive with the public, rather than focusing on kind of individual cases of elder abuse to drive some of that sympathy that we have tried to do in the past. This is shown to be a lot more productive with the public. And I'm going to walk you through that new communication strategy by showing you some clips or screenshots from our new public service announcement from the NCEA. So this communication strategy is called the Structure of Justice narrative. And the first step to utilizing the Structure of Justice narrative is we have to start off by talking about, why does it matter? Why does the issue of elder abuse matter? And we do that by utilizing the value of justice. So justice is something that we can all agree upon. I think that everyone on this webinar right now can all agree that they want to be treated equally, regardless of their age or ability. So justice is a way to get people invested in the conversation, but also it's a way to promote collective responsibility for our issue, and then also boost support towards solutions as well. So you can start off by saying something like, to live up to our ideal of justice for all, we need to work to address the social issue of elder abuse. The next step in utilizing this structure of justice narrative is we need to talk about, what is this about? And we need to, when we explain what the issue of elder abuse is about, we need to utilize examples and explanations and a metaphor. And the metaphor that we use in our communication strategy is the metaphor of a structure. You can say something like, it's important to understand what creates the risk of experiencing abuse or neglect as we age. A strong and just society is like a structure supported by many beams. We need strong beams that are frequently maintained. You can think of these beams as the policies and programs that reinforce the relationships and resources needed for health, happiness, and safety. When those support beams are missing or not maintained, the structure is weaker and may not meet our expectations that people are able to live free from abuse or maltreatment. The first and most important step to prevent elder abuse is to reduce social isolation. So, as you might have heard, we use the metaphor of a structure, and you can see in the image on the right labeled metaphor, there is a structure there with a family member trying to hold it up alone, but she can't hold it up alone. So it gives this image of a structure that needs many beams of support in order to stabilize. This is what can help people build understanding of the services needed to prevent situations of abuse. In our public service announcement, we use an example. We call the older adult in these images, his name is George, but we use an example of an older adult. But it's not so much an individual case of abuse, and he is not the focus of this PSA. The focus of this PSA, the key player in the story, are the systems that come into play in preventing and reducing situations of abuse. So we focus on social isolation, a lack of caregiver support, perhaps lack of training and education, or ageism. And those are the key players in our narrative now. Instead of focusing on the person who may experience abuse, we make sure that those themes of support that are necessary are really the key player in the story. And that's what's really great about this narrative, is we're talking about this, we're widening the lens, talk about how all these systems are at play to really get people to understand how services can play a role in preventing and addressing abuse. And what that does is it really primes people towards solutions to our issue. And that's when we get to step number 3. We need to talk about what we can do. This is the last step, but it's probably the most important, because when I was talking to you all about the swamp when it came to elder abuse, when it came to elder abuse, the public had no solutions really to offer. So that's why in our narrative now, we really need to talk about those solutions when it comes to elder abuse. And those solutions really need to be collective solutions and not just kind of after the fact solutions like surveillance and prosecution that I mentioned before. The solutions that we mentioned in our public service announcement have to do with community centers that can play a role as an intergenerational space that allows older people to build relationships and participate in our society. We also talk about how teams and agencies working together is a really great way to enhance communication and therefore lead to addressing the problem of elder abuse. And then we talk about educational programs and the role that they play in helping people spot the warning signs of abuse. And I want to emphasize that these are the solutions that we utilize in the public service announcement, but there are tons of solutions out there. There's things like improving and maintaining in-home support services and case management that can help to prevent and address elder abuse. There's programs that we can implement to empower older adults instead of influencing cultural devaluation of older people. Research has a really great role to play in policy implementation and understanding the causes and consequences of elder abuse. And public transportation can help us stop social isolation and therefore notice signs of elder abuse sooner and solve the issue sooner. So all of this, these public service announcement images can be seen more thoroughly on our actual public service announcement video, and it's you can go ahead and access that by clicking on the bit.ly link on this slide if you so choose after the webinar.
All right, so this is Eden again, and before we go into showing you before and after examples of some pieces of material that we quote-unquote reframed, just want to check how everyone's doing so far. This is really a lot of information to digest, and we hope that it's clicking and that you're seeing the benefits of how you could utilize it. So, based on what we shared earlier regarding what elder abuse is, this was information that we used to develop several awareness material pieces, which is what we're sharing with you on this screen. This is probably one of our most popular pieces of literature that we disseminate at places like resource fairs and at conferences. And there's a wide variety of intended audiences, anyone from friends, family members, concerned parties, of course, older people themselves, and for professionals. So looking back at the swamp that Ali was discussing, we can detect a number of issues with how this whole piece was assembled. So all of you see the spotlight on individuals, for instance, the victim versus perpetrator sort of language. And what this does is lead people to making an individual issue or passing blame onto a greedy person. You also pick up on the terms vulnerable and caregiver popping up actually quite frequently. To me, what I found the most troubling was the subtitle. Does someone you know, a senior or adult with a disability, display any warning signs of mistreatment? Now, what do you think this implies? To me, it implies that an older person is inept and unable to detect any forms of abuse. taking a look at the pictures, let's look at the picture to the top right. The woman is timid and afraid, and this incites fear. The next image, the woman off in the distance, she seems isolated and left alone in a wheelchair, and she definitely looks like she's dependent on others. And again, hearkening back to the point of being vulnerable. Lastly, the hands, although they're a nice space filler and represent an older person, they're not really conveying a message that's fully aligned with the content. To me, it doesn't translate to a form of abuse. What I am finding that's effective is the red flag in the top right-hand corner. So just thinking about some of the concepts that are used here and the pictures, all of this combined actually reinforces victimization of older people and makes people feel fatalistic about solving the issue. So now Allie's going to actually walk you through the after and how we revised the piece of material.
Thank you, Eden. I'm so excited to share that we quote unquote reframed this very popular material at the NCEA called Red Flags of Abuse. Right away, you can see that we took away those images depicting of older adults as dependent and therefore vulnerable, and we switched it instead to symbols to get across our messages of the red flags of abuse. And we found that this is a way to still get our message across without cueing that deterioration model from the swamp. Secondly, we went in and we changed some of the language within the red flags of abuse material. So now in our material, we mentioned the metaphor of the structure from the communication strategy, structure of justice, and then we also mentioned the value of justice. You can see here that we say our communities are like structures that support people's safety and well-being. One of the most important ways we can all contribute to this ongoing construction project is by looking out for warning signs of maltreatment. So right here we use that structure, and what I like about the structure metaphor is there's room here. It's not just a matter of finding these noticing these red flags of abuse, but if we wanted to, we could even expand and say that there's other beams that are going on. So it shows that this is a team approach. This is one of the things that we can do, and we think it's really important, but there's also other things to do as well. And then lastly, we mentioned that justice, as I mentioned. Everyone at every age deserves justice. And then within the actual signs of abuse, you can see here in the example of financial signs, we took out any language that mentioned vulnerability, that mentioned the victim or the individual who may experience abuse, and any mention of the perpetrator, so that we can avoid that spotlight on the individuals, getting people focused on abuse as a two-person relationship, or not seeing past the condemnation or the victim blaming here.
So we're being very mindful of the kind of photos that we're including in our communications materials and even our World Elder Abuse Awareness Day logo and campaigning efforts. So let's discuss the befores and afters of these. Some of the common themes that I'm seeing based on the images that are shown here, very stark images, older people looking concerned. There's some sort of implying that there might be a heavy reliance on others. One person represented, it seems like there's a focus on the victim and individual, that they're only one person and that they're left alone and isolated and essentially tackling the problem on their own. The one man appears to be helpless and vulnerable, and the woman in the top right-hand corner, well, that's just a really shocking image of her injury. And what it makes you immediately think of is the perpetrator, and it gets you riled up and angry. And I'm not saying that you shouldn't get upset, because it should bother all of us, and that's why we're definitely here attending this webinar, and we're vested and committed professionals in the aging field. I'm just saying that research is actually showing that it doesn't create a productive dialogue about the topic. So what these sort of photos do is encourage dismissing any ideas of structural causes and solutions to elder abuse.
Thank you, Eden. These are what our images have changed to now. Our images are a lot more solutions-oriented, and again, we're showing images of older adults as participating members of our society. So images of older adults together, even with people of all different ages. We also have a solution image right there on the left-hand side. You have a healthcare worker working with an older adult to portray the image that healthcare can also be a part of the solution to helping out in preventing and addressing elder abuse. And then here's our new WEAD logo, World Elder Abuse Awareness Day logo, where we switched it to actual symbols, again, to try and avoid any negative imagery. We have people holding hands, so working together. And then we put in the logo the slogan saying, building strong support for elders. So we use that metaphor of a structure to portray that we all need to work together. There's many beams of support. We all need to be building it to help protect the well-being of older adults everywhere.
So at the NCEA, we're very active on social media. We used to disseminate weekly news feeds to share stories about different instances and allegations of abuse across the country. And what was included was language that really provoked emotions and, again, riled people up. People absolutely need a platform to share their stories, but the fact is that it really shouldn't be happening to people, and that should be focused on. However, what we need to be integrating in social media posts and just disseminating headlines are things that are working. So productivity and moving towards solutions. So what this scenario, fake handyman charged in an elder abuse case, and kind of alluding to a contractor scheme, it does, of course, alert people. But what it's doing is sharing we hope that we could reframe this into something that is sharing information about a needed systems change. So some examples of very descriptive verbs that people would have a tendency to use in the past, or our team, it would be including things like beat, provoked, bilk, stole, and ransacked, and similar verbiage to that. Again, like some of the language and pictures you saw, this is an emphasis placed on one person, and in the case, the perpetrator. And it makes the older woman appear that she's alone and ultimately that she's helpless.
Exactly, Eden. Yeah, we want to move away from those focus on the individual cases. This is what our social media posts have changed to now. Supportive communities and resources are essential to engaging older people and preventing elder abuse. Check out what San Jose is doing to encourage aging in community. So right here, we have solutions that we highlighted on social media. So we're putting those solutions out to people, since so many were so fatalistic about the issue of elder abuse. And we're talking about supportive communities, so really preventative type of solutions to elder abuse. And so in the hopes this will lead people to be more hopeful about solving the issue, and they would utilize this example to work toward that in their own community.
So a local organization in Los Angeles County, California, which is where we're situated, called Wise and Healthy Aging, actually took the initiative on their own to utilize the Reframing Elder Abuse strategy. As you can see, there's fairly minimal wording, but let's go through and walk through this as an example so you could see what's exactly ineffective with this messaging. So first of all, the photo is implying that the woman is helpless, that she's deteriorating, and that she looks vulnerable. The black and white photo also gives a very dramatic and somber feeling. She's looking down, she's not engaging anyone and looking straight up. And she really looks like she's someone else's responsibility, connecting back to that concept of an object of care and not an agent of her own care or even a resilient woman. So as you can see, there's really a lot that you can imply from this photo. Another thing that we'd like to point out is that style really matters. Do you see the cracking and fraction font that's being used in the Stop Elder Abuse language? And probably the most important thing to note about this image of the publication is about the opening line, a resource guide for protecting, preventing, and stopping abuse. And how I would perceive this before even opening up this piece of literature is that this is a guidebook about how to prosecute cases of elder abuse and not really about how to prevent and intervene.
Thank you, Eden. And this is what that material has changed to now. I mean, I won't even go into it very much because I think that the contrast of it is just so well displayed. The images are brighter, more warm colors, which leads you to be a lot more hopeful. There's that value of justice mentioned right from the beginning. And then you've got an older adult who is an agent of change participating with a child. So all walks of life. Solving the issue of elder abuse is something that can benefit everyone and not just older adults. I want to say that we're so happy that this material has changed. This is something that's being disseminated to residents in LA County, and LA County, has close to 10 million people living in it. So we're very excited about the accomplishment of getting this material reframed.
So next, and we'll probably go through this last example a little bit more quickly, just for the sake of time. This is a publication that the United States Postal Inspection Service consulted with us about, and we were able to provide them with expert technical assistance. So what's really standing out for me again are the photos. The first photo to the left is implying that we should relate conversations that we're having with older loved ones to conversations that we had in our youth. Discussions on scams and fraud should not in any way, shape, or form be connected to the birds and the bees conversations. Of course, we want to watch out for others, but what about promoting self-empowerment? The image to the right isn't necessarily doing that. And we want people of all ages to be informed citizens. The title, Protect Your Loved Ones from Being Scammed, also implies older people are not capable, again, of protecting themselves.
Yes, that material is very paternalistic, Eden. So we're really excited that they went ahead and they changed it, utilizing some technical assistance from us. This is what their material has changed to now. It takes a village, so that theme of collective responsibility and the need for community strength so that we can prevent and address abuse. And then some of their text has changed as well to explain how social isolation is a risk factor in preventing financial exploitation. They say our society currently does not keep people connected to their communities at all stages of life. That leaves older people at greater risk of being abused, especially by fraud and other forms of financial exploitation. To correct this, we need to ensure our communities are set up to reduce social isolation. And then it goes on. So they're explaining the risk factors of abuse, which therefore expands the definition of elder abuse beyond this two-person relationship, something where you condemn a perpetrator or blame a victim, but instead focus on systemic factors and the causes of abuse. So what can you do to promote this strategy to the public? Now that we've shown you what the NCEA has done and what other organizations are doing, we wanted to give you some advice. Number one, cultivate thinking about older people as agents of their own lives, not objects of care. Secondly, connect the role of social structures and systems to the causes and solutions of elder abuse. So talk about the role of healthcare, the role of empowering older adults, the role of social isolation. And then we also have a Talking Elder Abuse Toolkit that has a lot of different guides on utilizing this communication strategy that you want to use, and we'll show you how to access that. Please practice applying this. It takes a long time to learn. I'm a project coordinator, and it took me a while to learn this as well. It's like a whole new language. And then the NCEA already has reframed materials. We showed you that red flag. So a way to contribute to utilizing this strategy is by utilizing our existing materials. We're happy to share those with you. We also have a World Elder Abuse Awareness Day campaign, like the logo that we showed you earlier. So participating in those campaigns, those already existing things, is a way to help out in utilizing this strategy. And the Frameworks Institute also has training resources out there as well. Here's some of the links to some of their materials. The Talking Elder Abuse Toolkit has those guides. It has the SWAP that I went over in that slide. It has a quick start guide, which is quick, like do's and don'ts when it comes to communicating about elder abuse. And then there's a really great video lecture series, which is like an online course, and it's now free for up to a year. The coupon code is WEAD2018. So just make sure to enter that, and you'll be able to access this online course. It goes way more in depth than we were able to today. So please utilize that. Check out our public service announcement, and then some of our materials that we have below under elder abuse awareness, like our red flags that we showed, facts of abuse, top 12 things that everyone can do.
So we'd like everyone that's joining us today to really assist us with promoting our cause and, more importantly, promoting justice for older people. So just want you to keep in mind some of these key takeaways. We know there are many types of people that are on the call today, anyone from caregivers, family and friends, educators, social service providers, attorneys. We want you to keep these things in mind to get people involved in this very important issue. So first of all, we need to have more students, professionals, and community members involved. And that way, the federal government will continue to make this a priority issue and fund research to continue to make this a relevant topic. Participating in commemorative days, as Ali had pointed out, World Elder Abuse Awareness Day. We just wrapped up a very productive campaign. Always reaching out to collaborate with others so that you're sharing your interest and you're tackling cases on an individual basis is another way that you can get involved. And finally, promoting solutions and ensuring that you're participating in trainings and getting involved in local and state policy work around the issue. They're all very effective ways to continue to move this field forward. So in regards to some of the brief highlights that we made on the different forms of elder abuse, this is our go-to resource list when we're engaging with people through email, through written mail, and through the phone. And these are the resources that we oftentimes recommend when people need direct assistance in their area. So we have a list of how people could get in contact with Adult Protective Services and local law enforcement in their vicinities, caregiver resources, how to follow up on abuse in long-term care settings, and just a plethora of financial resources. So if you ever have any questions, you could always feel free to reach out to us or inquire with us at the end of this presentation.
Okay, so I think next is on to AFA resources and support. Molly, did you want to?
Absolutely. Well, before we even get to that, let's get more importantly to some of these great questions that we've been receiving throughout the presentation so far. Thank you so much for such a thorough understanding of all the great work that you're doing and how we as care partners can continue to best assist the community we're here to assist. So if I could, I'd love to go to the first question. What do you do if a caretaker, and this comes from Patricia, what do you do if a caretaker tells a law official about some kind of abuse? They look at you like you're stupid or just report their identity as stolen. They just claim the person lost it. What happens if you tell people and they do nothing? Wow, great question, Patricia.
That is a really great question, and it's something that we oftentimes hear about, and it's very unfortunate that there are some professionals that don't necessarily know how to help people navigate resources. So in terms of something coming up as like a scam and allegation of abuse by a potential caregiver, there are different resources that people can get in contact with. Again, we have that list of response resources, financial resources, and ensuring that the older person, that this case is brought up to the attention of Adult Protective Services would be a very important first step, in addition to reaching out to the police. Sorry to hear in that sort of situation that the police weren't very responsive. Hopefully, when a situation like that is brought up, it could be a future learning opportunity for that precinct so that they could be better informed in elder abuse cases. And that's why I would suggest also trying to push to talk to a supervisor in the office and see what sort of intervention could take place. Oftentimes in financial abuse scenarios, it might be a little too late in terms of if someone's like approached to send a Western Union check or a Western Union transfer of money to someone, and there aren't any tracking mechanisms in place. There are actually a list of organizations that you could report fraud to. So Consumer Financial Protection Bureau, Better Business Bureau, Internet Crime Complaint Center, if they are like predators who are contacting that are from businesses. Another thing that I wanted to mention in terms of potential abuse is to contact, if it's like a professional caregiver, to contact that person's home care agency and the local licensing bureau who oversees that home care agency. Those are kind of some of the resources that we would suggest, but just it's very important to be persistent and to follow up and get in contact with as many organizations that you can. And if you need particular guidance on a case, you could feel free to email us, and we'll be providing our email at the end of the call.
Excellent. Thank you so much. And again, great question, Patricia. We've got a few others. There have been some questions about where this will be recorded. This will be recorded and will live on AFA's website, alzfdn.org. You see it on the screen in front of you under Caregiver Resources in the webinar section. Let's see. How would you advise, this comes from Bella. Hi, Bella. How would you advise a family if the elder has dementia and seizure disorder, but wants to live with her adult son who is diagnosed with schizophrenia and has taken money from her? She loves her son and doesn't recognize the danger. She refuses to move to assisted living and wants to live with him. Very interesting question. Thanks, Bella.
That is a very interesting question, and again, something that is brought up to our attention. And there's something called self-determination that comes into play, and even though there are people that are around outside concerned parties who are concerned about the person's well-being and they're noticing red flags, sometimes people can't intervene because it's ultimately what the older person wants and the wishes that they express themselves. In a situation like this, because you said that she is diagnosed with a form of dementia, I would definitely open up an Adult Protective Services case. And I feel like keeping a paper trail of just reporting concerns and maybe multiple parties reporting concerns, they're going to have a caseworker intervene and investigate the situation and hopefully be permitted to come into the house and observe kind of what's going on and maybe let the local law enforcement agency know so that they keep a watchful eye. I think just really getting as many advocates behind the woman and just empowering her to protect herself and watch out for her finances or her physical safety and welfare, and just staying in connection with other people will also be very important. Allie, did you have anything to add for that?
No, I think you captured it all. Yeah, there is that self-determination, and I think we do have a resource on adult protective services and what they can and cannot do. That might be a very helpful resource for this type of situation, because self-determination, is something that every individual is entitled to. So that might give this person more understanding of what adult protective services can do in this type of situation. Yeah.
And something else that I wanted to note, it's really important to have the dementia documented and to have this person evaluated. I feel like it would be helpful to have justification in the instance that there is a responsible party who's willing to step up and maybe petition for guardianship, and if it's determined by a group of direct family members or other people that are in her life that are looking out for her welfare, I think that the whole transitioning potentially to an assisted living or a memory care unit or into a long-term care facility, if that's determined to be the thing in her best interest, that a person would have that authority to do so if they, for instance, petition for guardianship.
Excellent. Thank you so much, ladies. We've got a few more questions here. Ms. Freeman, I see a question here from you. If you report abuse and neglect to the supervisor or administration and it still occurs consistently, what do you recommend to do next?
I would explore, it really depends on what state that you're in. I know that some attorneys general offices or office of the inspector general, they'll collect these sort of cases. I think even going to the length of getting the media involved and contacting a local news outlet can be effective, and letting the person who you suspect is the perpetrator kind of, I don't know if it's sort of a comfortable situation to let them know that you're willing to expose them if they don't stop. Trying to think of some other organizations, contacting local legal aid office to see if there's any sort of advice that they might have. I know that it could get complicated, and there are state adult protective service offices as well, instead of just offices located in a local jurisdiction. So in that instance, again, if you want to reach out directly to us for further in-depth case consultation, we could probably provide you with a more solidified list of resources.
Excellent. And if you, ladies, can you go back to your former slide? Is your contact information on that slide?
It might be at the end.
At the end. Do you want to bring that slide up just because there's a few folks asking? There you go. Excellent. So because I believe, Alyssa, your question next about can you email the document out regarding adult protective services, what they can do and cannot do, self-determination, etc. If you guys want to just reach out to both Allie and Eden on their emails here, I'm sure they'd be happy to send that information along. And ladies, if you don't mind sending that information to us as well, we can go ahead and share that to any participants who are looking.
Sure. Of course, yes.
Excellent. We've got another question from Andrea. There are times when a mother of a handicapped child now that is an adult cannot give up the special bonds. This can make separation difficult. Any safety issues for the mother? So when a mother of a handicapped child who's now an adult can't give up that special bond, and you're saying now that I believe, Andrea, you're saying now that mother is trying to separate the two, the mother and her adult child with special needs, is really challenging and can create some safety issues. So I'm wondering if there's any recommendations.
Well, there are support groups out there, so it may be helpful to look for support groups in your community, because sometimes just having a dialogue with other people who may be caregivers of older people or adults with disabilities can be helpful in that type of situation. So that's what I can recommend at this point. So I would recommend some caregiver support groups, maybe looking for any caregiver resources that you can find.
Absolutely.
There are national caregivers.
Yeah, and actually, here at AFA, if you want to go back to the slide prior, some of the resources that we have while we wait for any last-minute questions to come on in, some of the resources we have available include caregiver support groups. Our support groups, for those of you who aren't familiar, are free, and they're also held virtually over the phone. So we have 3 current support groups: caregiving, a general caregiver support group, a support group for spouses of young onset dementia, and then also the third one is for caregivers who have recently placed their person in a long-term care setting. They're all facilitated by our licensed social workers, always free and held weekly over the phone. So that might be a great resource. And our helpline as well, which is that 866-232 number. That helpline is always staffed by licensed social workers and a great resource for any of your caregiving needs. Yeah.
Thank you, Molly.
No, thank you guys. Any other questions? I don't see Eden or Allie's email address on that former slide or your slide that you guys have with your contact information.
Yeah, so what we do, because we count this all towards our technical assistance, we filter all of the emails into our NCEA information box, so that we could triage accordingly. But if people just want to address Eden and Allie, and the fact that you joined us on this presentation, we're glad to directly respond to your inquiries. We do this so that we could better capture data and analytics.
Yes, but we will. We all see these emails, so Eden or I will definitely answer at this email as well.
Yeah.
Excellent. And again, feel free to, Eden and Allie, to send this to us here at AFA, and you can respond to the webinar information, and we can get the webinar email, and we can go ahead and get that information to you as well. Great.
Perfect.
Thank you. So again, we want to thank everyone, especially Eden and Allie, for joining us today for this fantastic presentation. We want to thank all of the participants for joining us today. Please share this information with your colleagues. Make sure that you spread the word. Also, please do know that this webinar will be recorded, and we look forward to seeing you all again for our next Care Connection webinar held on August 9th, always the second Thursday of the month. So the next one will be August 9th, where Britt Berner, an elder care attorney here in New York, will be talking about what there is to know about guardianship. So we do hope you'll join us back then. Thanks again. At this time, we will be ending the webinar. We look forward to seeing you again next time. Have a great afternoon. Bye, everyone.
Thank you.
Thank you.